Hello, my name is Anna Robinson with Howard Head Sports Medicine.
And I'm Tom Clanton with the Stedman Clinic here in Vail, Colorado.
And we are coming to you with our second coffee talk today with a focus on syndesmotic injuries of the foot and ankle.
Correct. And so we often wonder how patients here in a ski area can injure their ankle inside a ski boot. I mean, that just seems like that couldn't happen when you've got your ski boot buckled tightly.
It does, and so sadly today we are debunking that myth and reviewing specifically the syndesmotic injuries that we've seen.
That's right. And so what happens is you can have the ski boot buckled down very tightly, but it is possible to still see rotation of the ankle within a ski boot. We've seen everything from fractures around the ankle to sprains, all the way to even a dislocated ankle in someone who was wearing a ski boot. Now, usually that occurs because they haven't buckled down tightly, but even ski racers will sometimes injure their ankles inside their very tightly buckled ski boot.
And so for ski racers specifically, they're often rotated in a forced manner against their gait. Is that typically?
That's right. So oftentimes they will catch a ski on a gait, and that can rapidly rotate the ankle, and so even if it doesn't create a fracture of the ankle, it will often tear the ligaments that connect the tibia and fibula together. We call that a high ankle sprain because it's just above the location of the typical lower ankle sprain that's the most common injury that we tend to see in sports.
How does a man from Texas keep his feet warm in the winter skiing?
Oh, that's really hard. So we certainly didn't have the problem in Houston. But here I have learned that, number one, you don't wear thick socks in your ski boots, which I always thought I was supposed to do. But I've learned that thin socks actually help keep your feet warmer, as long as they're wool. And then probably the most important thing that I've learned is that it's really worth it to buy some heaters.
Yes.
for the boots. So liners that are heated make a huge difference.
So when a patient comes into your office and you are thinking that they may be surgical candidates after a syndesmosis injury,
Right.
What are the clinical signs and symptoms, and then what do you use radiographically to help you make that decision?
Pain, more swelling in the upper area rather than the lower area of the ankle. And then we can have them do some very specific tests, like a hop test, where they would hop on a single ankle. And obviously you wouldn't do that if they have a fracture,
Right,
but
right.
if you think that it's just a high ankle sprain, that brings out the area of discomfort more. And you can also have them stand on the affected ankle and then rotate their body over that, and that usually produces pain in an ankle sprain. It's important to document whether it's an unstable injury or not, and so that can be done with imaging studies. So regular x-rays will sometimes be enough to see widening of the space between the tibia and the fibula, so that's fairly obvious when you see it. And then other times the ankle has a tendency to try to go back into the correct position because it's very elastic in that area, and so it may be harder to tell that. And that's where a test such as an MRI comes in, because you can actually see the ligaments on the MRI and see if they're torn or not.